There are several fundamental points that patients should pay attention to when considering different treatment options. As a rule, the diagnosis of cancer comes suddenly to the patient and his family. Or the patient has been suffering for a long time and believes that the treatment options at his place of residence have been exhausted. In both cases, when contacting medical tourism agencies, it is important to remain calm and maintain common sense. Calmly find out whether the doctor will consider the request, whether the answer will be individual for the patient. What are the arguments in favor of the clinic? The answer from the agency should imply a clear separation of the cost of medical services and the cost of organizational measures. With the right organization of the process for an international patient, coming to Germany gives the opportunity to have access to the full range of modern diagnostic and treatment methods in the conditions of one institution with the status of a specialized center. For example, the breast cancer center or the prostate cancer center, etc. It is the specialized centers that constantly monitor rapid changes in the state of issues about the treatment of certain diseases. Often, our clients' stories about treatment at their place of residence are that the examination was performed in one clinic, ultrasound in a second, surgery in a third. They went to another city for a consultation, looked for chemotherapy and found it possible in a neighboring town, etc. In Germany, an international patient does not need to rush between different institutions. Of course, there are exceptions, for example, in the case of rare diseases or the use of unique methods. Doctors coordinate the patient's treatment where they have the most experience or the necessary technology. It is also important to ask the organizing agency about the features of the city, possible living conditions, climate, and nutritional features. For example, our region in Western Germany, the city of Essen and other cities in the immediate vicinity, in addition to concentrated medicine, offers accessible infrastructure and reasonable prices for issues of everyday needs of medical tourists. A tolerable climate at any time of the year is also important for elderly and weakened patients. It is worth noting the excellent ecology of our very green region. Cancer treatment requires close cooperation between specialists from different medical fields, since it is necessary not only to develop, but also to successfully implement an individual plan for each patient. Cancer diagnostics include several stages and the use of various methods, such as imaging studies, laboratory tests, and tumor material examination. This process involves radiologists, pathologists, geneticists, and laboratory specialists. The joint work provides an accurate determination of the type, stage, and characteristics of the tumor, which is the basis for further treatment planning. Modern cancer treatment methods include surgery, radiation therapy, chemotherapy, immunotherapy, and targeted therapy. For example, a surgeon can remove the bulk of the tumor, after which a radiotherapist does everything possible to affect the remaining cancer cells. And a chemotherapist prevents relapse with medications. Immunotherapy is one of the revolutions in oncology. It makes the patient's immune system fight cancer cells, which has been studied to the greatest extent in melanoma, lung cancer, and kidney cancer. Doctors note a significant improvement in the survival rate and quality of life of patients receiving immunotherapy. Liquid biopsy will play an increasingly important role in the future in detecting cancer at early stages and choosing the most effective drugs for treatment. Today, at the individual request of the patient, we can already facilitate the analysis of gene expression in tumor cells circulating in the blood, or in tumor material taken during a biopsy or surgery. Germany provides high-quality medical care to both its citizens and foreign patients. There are no separate hospitals for medical tourists. In turn, special agencies, such as our company DeutschMedic GmbH, are engaged in the selection of clinics, the organization of travel and accommodation, the translation of medical documentation, as well as support at all stages of treatment.